We are joined now by Dr. Atul Gawande. He is a surgeon at Brigham and Women's Hospital in Boston and a professor at the Harvard T.H. Chan School of Public Health. He's also a member of President-elect Biden's Coronavirus Advisory Board. Good morning, Dr. Gawande. Thanks for joining us.
Good morning.
Dr. Gawande, if so far we've vaccinated 2 million people, or at least they've received that first dose, that sounds like a big number, but really we're behind schedule. Operation Warp Speed said that they wanted to vaccinate 20 million people by this time, by the end of the year. What will the incoming Biden administration do, not just to catch up, but to go faster?
There's going to be a ton to do, and we still don't have all of the information that's required to understand where the bottlenecks are. If there are ingredient shortages to make the vaccines, then we will invoke the Defense Production Act if necessary to generate the ingredients needed. If this is a problem of distribution, then we're going to need to understand where the bottlenecks are. There's so many steps along the way that are critical, and the reality is it's one administration at a time. But come January 20, I think the Biden administration will be much more transparent and clear about where the challenges are and what the opportunities are and how we're going to solve them.
I know there are still a lot of unknowns from your perspective, but the HHS Secretary Alex Azar said that by June of 2021, anyone who wants to be vaccinated should be able to be vaccinated. Do you think that is still a realistic timeline?
I'm worried about overpromising on when things are going to be able to be back to normal. You have to build in that there are going to be hitches in this process, and we're already seeing it in the first couple weeks getting started. I think the realistic picture is to expect that it could be fall before things are really enough people are being vaccinated that we're getting back to normal, and that it might be summer before the general public is really accessing the vaccine. The Biden administration will do everything possible to accelerate this process, but I think we have to be straight with people. We've been consistently underestimating the virus and overpromising what will be accomplished, and that has to change.
Now, talking about AstraZeneca, of course, that vaccine's been making a lot of news. The UK is expected to approve it any day now, but initial data said it was less effective than the Pfizer and the Moderna vaccines. Now AstraZeneca is saying it's just as effective. How unusual is it to see a change in efficacy like that?
It's confusing, to be honest. There were the early reports were that there were two different doses, one that wasn't as effective as another, which was at 90%. Now they say that they have a 90% effective dose regimen. That's possible. This is a reputable Oxford group created the vaccine, and AstraZeneca is a reputable pharmaceutical company. But you know, at this point, we really have to see the data to trust that this is true. And it would be a huge boon to have a third vaccine available, especially this one is a tenth the cost of the current vaccines.
Dr. Atul Gawande, thank you so much.